Hello, dear subscribers and future subscribers. I am still in office waiting for my hubby at it's time to go home. But before that, I want to share with you some tips to ensure patient safety. Being Chief Nursing Officer, that is one area of my focus. So, I will start with the IPSG1, that is identify patient correctly. Other hospital are using name and UHID number of the patient, that is unique hospital identification. Other hospital are using name and MR number. IPSG2 says about improved effective communication. With improved effective communication, so we have SBAR handover. So like what is SBAR? Situation, background, assessment, and recommendation. This tool is actually being used in order to facilitate, to strengthen communication between nurses, physicians, and other paramedical or healthcare team throughout the implementation of the patient stay, for example. And that is in order to improve patient safety. Number 3, IPSG goal is what we call improve the safe and high alert safety, improve the safety of high alert medication. So in here, we can use the acronym NIT and CLEAN. So when we say NIT, we call it narcotics. For example, some example of the narcotics would be morphine, fentanyl, and pethidine. And then let's have the E. So the E are the concentrated electrolytes. So what are the concentrated electrolytes? So it can be the potassium chloride, magnesium sulfate, potassium phosphate, and hypertonic saline. And then we have the A is anticoagulant. So what are those? Example, warfarin, heparin, IV. And then our thrombolytic agents, the T for the NIT is the thrombolytic agent. Those are like the TPNs, total parenteral nutrition. Then we have also the CLEAN, in observance of the NIT and CLEAN. CLEAN is spelled C-L-I-N here. So when we say CLEAN, we are using chemotherapeutic drugs, look-alike, sound-alike medication for L, I for insulin, and N for neuromuscular blocking agent. So that is in other hospital or in our hospital, we are very much reinforcing that there will be at least 2 nurses to give such medication, because like for example the narcotics, there should be 2 person, like 1 senior and 1 staff nurse, and they should have a sign up at the end of the administering medication. Of course, you have to follow the 6 rights, 7 rights, even 10 rights of giving or administering medication. So next is what you call the IPSG4, where we have to ensure safe surgery. So what we observe in safe surgery? So we have to observe the check-in, the sign-in, time out, and sign out of the patient to the OR. Then we have the IPSG5, that is reduce the risk of healthcare associated infections. So the very foremost requirement here is to do the 5 moments of hand hygiene, and also do the hand hygiene, which is our universal precautions for infection. So there are 2 types of hand hygiene. For those visibly soiled, we can use the agent of soap and water. While not visibly soiled hands, you can make use of your hand rub or alcohol-based hand rub. Next of the IPSG, which is the last one, is IPSG 6, reduce the risk of patient harm resulting to fall. So this one, guys, you have to identify the types of the classification of falls, like high, low risk for fall, moderate, and high risk for fall. So the high risk for fall, you have to ensure that there should be a fall risk assessment checklist. And what are those tips that the nurses should do or other attendants should do? So the side should be up, the bed should be lower down, and if it is vulnerable for fall, the patient room should be near the nurse's station, and this should also be well explained to all that the patient is not allowed to go to the bathroom alone. So you can pay some guidelines for this IPSG 6 to reduce the harm for fall, especially those people who are already fall risk. There are some who are already had the fall, previous attack, and again, we have, and of course, you consider the age of the person or the patient, those mothers who are already in labor, severe labor on the later stage. So you have to ensure that they are taking care, and other hospitals consider that all or ICU patients are considered candidates for fall. So this is what I can remember so far in IPSG. But if you have any queries, guys, you can engage in a discussion. You can also share your comments, or you can also like the video if you like it, and you can also share the video. Please stay tuned for the future vlogs or future videos that I will share. Thank you so much for patient watching and hearing.